Hi, I'm Dr. David Murr,
And I'm Dr. Indira Murr.
and we're the co-founders of Blue Sparrow Wellness. It's a health and wellness lifestyle coaching venture that we're starting here in Tulsa, Oklahoma. We're going to be talking about healthy living, nutritious foods, how to exercise, getting good sleep, stress reduction, all of the things that are important for a vital and healthy lifestyle.
Mm-hmm. And we're glad that you're here. We're glad that you've stopped by to see what we're all about. And we're just going to tell you a little bit about ourselves and kind of what interested us in doing this and why. So, honey, what is it that interested you in health and wellness, and what is it that made you want to start a venture like this?
So, as a family doctor in training, of course, taking care of the whole person is important, both for chronic illness, but also even prevention. And as a person with diabetes on an insulin pump all the time, it's important to take care of yourself. And actually, some of the greatest improvement that I had in my diabetes control came from you with working on my diet, predominantly a plant-based diet. But also working on exercise and stress reduction, and over time it's actually been some of the best control of my blood sugars that I've had. And so there's so many things that we've learned over the years that we feel like it's time to share with others and hopefully transform your life with healthy living.
Mm-hmm.
So, yeah. And how about you? What do you think is brought you to this point and how we're going forward together?
Well, I would say that it started with when we got pregnant. I was an athlete growing up, and so we worked out so much. I never really paid much attention to what I was eating. I always just trained really hard. But when I got older and when I started having kids, I realized that I had to pay a little bit more attention to what I was putting in and how I was treating my body. So, and of course I wanted to have healthy pregnancies. I wanted to give the best that I could to our children. And so I just started reading a lot about what I could do nutritionally, what I could do, how I could exercise during my pregnancy, and the things that I could do to stay calm and centered and stress-free during my pregnancy. And then it just carried over into my life after the kids were born. I just wanted to continue to take care of myself as well as provide as much as I could for you and the kids that would foster your health and wellness and well-being. And I just found over the years, after just reading lots and lots of books by physicians, integrative physicians, and lifestyle medicine physicians, attending conferences and integrative medicine conferences, and then just learning a little bit more about the holistic nature of true health and wellness, the holistic nature of healthcare. We've both been in healthcare for 20 years, 40 years collectively, and we know how to treat people. I'm an emergency physician. David's a family physician in urgent care. We know how to treat people with medications. We know how to treat people with procedures. We know how to treat acute illness. And I think that our medical system does really well in the management of acute illness. But we can do a little bit of work in the area of chronic disease management, as well as just teaching people how to be well and stay well. I think in this, now that we're emerging from COVID, and we've all learned the importance of, like the major risk factor, one of the major risk factors for COVID mortality and morbidity is obesity, and that's something that we can work on. That's something that we can manage and we can prevent, and if we don't prevent it, then we can help people get back to normal BMIs and healthy lifestyles that will help them with their immunity and help them be well and stay well.
And some of the other high risk conditions related to COVID, interestingly, was anxiety type disorders. And there's so many things that kind of relate to stress and anxiety and depression and kind of how we think about things that even some of the things that we're going to be talking about could reduce and improve as well. So,
Yeah, I think that's another thing is that we can bring as physicians to the table is that we actually do have a lot of data. We have a lot of the, we have over the years, we've been studying this for about 15 years now, and we've collected a lot of scientific data in support of nutrition, in support of practices that help with overall a sense of well-being, that support anxiety reduction, and teach people how to implement what we've learned about physiology and how it all is related to each other. Our cardiovascular system is intimately related to our renal system, and that's intimately related to our nervous system and our gut. And so all of our systems are integrated, but also holistically, our emotional state and our physical state and our how well we're rested, our physiologic state, that's also integrated. And so we're taking what we've learned from our knowledge of anatomy and physiology and what we've learned in, through our traditional allopathic model, as well as what we've learned from our integrative and alternative and lifestyle medicine model, bringing those together and teaching you how it's all related and how we can kind of fix what's broken and also prevent us from becoming broken.
Yeah, I think you said it really well, and what we're really hoping to do, if you want to learn a little bit more about us, go to bluesparrowwellness.com, and we've got our bios and gives our background and what we're hoping to do. And then be sure and kind of tune in for periodic updates where we'll try to cover, important things like how to shop for healthy foods without breaking the bank, how to exercise effectively but also safely, how to sleep better, how to reduce stress, and a lot of the things that like we said, are really important for healthy living these days as we've coming out of COVID, but also no matter what situation would come up, we want to be well. So
yeah, we just want to share what we've learned and teach you how to be well, and then each one can reach one. As you learn how to be well and you become healthy, you can influence and improve the lives of other people around you.
Yeah. All right. So we'll see you next time.
Thanks for joining us.